According to the public spending watchdog, the government has acknowledged that expanding paid daycare for working parents without first conducting tests could pose a significant risk. The decision to halt a £35 million trial program in a few locations, according to the National Audit Office, now raised questions about whether childminders and nurseries would be able to implement it across the country. The extension of free childcare in England is expected to cost £15.2 billion over the course of the next 3 years, and it started earlier this month. According to the Department for Education (DfE), decisive steps have been done to prepare the industry. The external study stated that although the DfE considered testing to be critical to the implementation of the 30-hour program for 3 and 4-year-olds in 2017, the expense of testing the market prevented them from doing so this time. Recalling early testing plans exacerbated the significant uncertainty about the sector's capacity and financial sustainability, according to Now Chief Gareth Davies. The Now advised the DfE to keep an eye on the expansion in case it needs to re-evaluate the schedule because of staffing and place numbers issues. All eligible preschoolers whose parents work will have access to 30 hours of free nursery during the school day by September 2025. Official projections indicate that by September 2025, up to 85,000 additional childcare spaces and 40,000 additional employees will be required. To provide the industry time to adjust, the reforms are being implemented gradually. According to the NAO, the dates of the program were set before the DfE or the Treasury had a clear idea of whether or not nurseries and childminders would be able to provide the required number of places. According to the report, the DfE acknowledged that implementing the expanded free hours would be a significant risk, and that there was a amber-red, or problematic, chance of providing the required number of places. Alison Vickers, a 30-year Sheffield nursery manager, stated that, up until the last several years, hiring new employees had never been a challenge. "It's not conceivable," she declared. "We essentially run advertisements all the time, and the goal is retention rather than just recruiting. I'm losing employees to higher paying roles in different sectors, and it's really tough for me." Nearly 200,000 2-year-olds are reportedly already benefiting from government-funded spaces that opened in April, according to the authorities. However, because many of the 2-year-olds who were eligible for free hours this month already had a nursery spot, the Now noted that the next 2 phases would be riskier. Social worker Sophie Rayner said that she was having trouble finding a childcare provider in Wakefield that would have enough hours available for her return to work, even though the city will require a 30% increase in childcare hours by September 2025. After attempting more than 10 childminders and nurseries, she declared, "It's a nightmare. The only days I will be able to work are Monday and Friday because that's when I can find spaces." According to the NAO, it's unclear how many parents will take advantage of the extra hours to either return to work or work longer hours. This raises concerns about whether the extension will accomplish its main goal and be cost-effective. The research also brought to light worries about the difference in academic performance between kids from wealthier households and their less fortunate counterparts may widen. Nursery settings may quickly outgrow youngsters who are more difficult or expensive to care for. The entry of a significant number of inexperienced or underqualified workers could compromise quality. It states that the DfE should keep an eye on how funded hours affect the quantity and caliber of spaces available for underprivileged kids or kids with special needs and impairments. The DfE missed opportunities to learn, which would have helped it better understand, and mitigate against, the challenges local authorities would face when expanding entitlements, according to Meg Hillier MP, chair of the Committee of Public Accounts, who expressed regret at the cancellation of early testing plans. The government is delivering the largest ever expansion of childcare in England's history, according to a DfE spokesperson. "We have taken decisive steps to prepare the sector for the next phases," the spokesperson continued. These include raising funding well above market rates, starting a workforce campaign, creating new apprenticeship routes, and providing £100 million, $124 million, in capital funding to support facility expansion or renovation. The extension of childcare draws on earlier successful implementations, such as the 2017 implementation of 30 hours for children aged 3 and 4. This time around, the lessons learned were put into practice.